Hi, my name is Diane. I'm one of the care advisors with Neuro Challenge Foundation for Parkinson's. Welcome to PD 101, or Parkinson's Disease 101. This program is supported by a community grant from the Parkinson's Foundation. I'm going to go ahead and share my screen with you. So today we're going to talk about understanding Parkinson's disease and the role of Neuro Challenge Foundation. What is Parkinson's disease? Parkinson's is a movement disorder that can affect your ability to perform daily living skills and activities. It's a chronic and progressive disorder of the brain and central nervous system, and the symptoms can gradually worsen over time. It's marked by a deficiency of a chemical messenger in the brain called dopamine. If you take a look at these pictures here, you'll see on the left is a picture of a healthy brain. On the right is a picture of a Parkinson's brain. The red indicates the dopamine levels in each of these images. And you can see in the Parkinson's brain, the dopamine is significantly reduced. Parkinson's is characterized most commonly by motor symptoms, but also manifests as non-motor symptoms, which we'll talk more about in a little bit. The reduced production of this dopamine can affect movement, mood, and thinking. Here's 10 early signs of Parkinson's disease. Tremor is probably the most commonly recognized. The small handwriting, known as micrographia, loss of smell, trouble sleeping, difficulty moving or walking, constipation, a soft or low voice, a masked facial expression, dizziness or fainting, and the stooping or hunching over. These are the four main symptoms, and it's important to know that two of these four main symptoms must be present over a period of time for a neurologist to consider a Parkinson's diagnosis. That would be the shaking or tremor, the slowness of movement, also known as bradykinesia, the stiffness or rigidity of the arms, legs, or trunk, and trouble with balance or possible falls, also known as the postural instability. Most common signs, including for the motor symptoms, include the involuntary tremors, the slowness of movement, the rigidity or stiffness of the muscles, impaired balance and postural instability. Can also include difficulty initiating movement, episodes of freezing, which is the inability to actually engage in a movement, and the overreactivity of muscles, known as dyskinesia. Some of the non-motor symptoms are sleep problems, constipation, decreased facial expression, depression, anxiety, slurred speech, apathy, loss of smell, and cognitive impairments. Many people have these symptoms prior to their diagnosis. When people with Parkinson's were asked to identify 3 symptoms with the greatest impact on their daily lives, the highest responses were related to the motor symptoms, impaired balance and coordination, and then the cognitive impairments or sleep issues. Cognitive impairments may include slowed thinking, memory, trouble paying attention or learning new things, difficulty remembering words or names, and multitasking. Delusions and hallucinations may also become a factor as well. Parkinson's disease is very individualized. Although we've talked about some of the common physical and non-physical symptoms, it's important to know that not every person experiences the same symptoms. They vary significantly from person to person, as well as the rate of progression. So when we talk about these stages of Parkinson's, it's difficult to put an actual time frame on moving from one stage to the other, again, because it is so individualized. But when we talk about early Parkinson's, we're looking at stages 1 and 2, and those are more of the mild symptoms. The movement symptoms may be inconvenient, but they don't affect the daily living activities. In the middle stage, it's more of a moderate. Stage 3 is more of a moderate stage. The body moves more slowly, may have some trouble with balance or in coordination. In advanced Parkinson's, in stages 4 and 5, it can become much more difficult to walk. Person may not be able to get out of bed without some assistance, may need to use a wheelchair regularly, and so forth. These stages help the doctor diagnose where you're at with the progression of your disease, which can help with treatment planning. So who has Parkinson's? Parkinson's can affect anyone regardless of race, ethnicity, or gender. Up to 1.5 million people are living with Parkinson's disease in the US. This is more than the combined number of people diagnosed with multiple sclerosis, muscular dystrophy, and Lou Gehrig's together. There are about 100,000 Americans diagnosed each year with Parkinson's. More than 10 million people worldwide are living with PD. And we know that about 10,000 people in the 6 counties that we serve are affected with Parkinson's disease. Incidence of Parkinson's can increase with age, and about 15% of people with Parkinson's disease are diagnosed before the age of 50. And that's classified as young onset or early onset Parkinson's. The average age of onset is about 62 years old. And Parkinson's can affect both men and women. So what causes Parkinson's disease? The cause of Parkinson's is still unknown, although there is some evidence for the role of genetics, environmental factors, or a combination of both. It's possible that there could be more than one cause of the disease. As far as environmental factors go, we're looking at things such as exposure, prolonged exposure to environmental toxins, such as pesticides or Agent Orange. It's estimated that 10 to 15% of cases of Parkinson's disease are due to genetic causes, repeated head trauma, a person's age, and as I mentioned, many cases can be idiopathic with no known origin. So when you're diagnosed with Parkinson's, the first thing to do, if you've not already seen a neurologist or a movement disorder specialist, is to get a referral. A movement disorder specialist is a neurologist that has additional training specific to movement disorders, such as Parkinson's. The diagnosis is made on clinical examination and your medical history. The response that someone has to Parkinson's medications can also help support the diagnosis. Seeking care from an occupational therapist, physical therapist, or speech therapist would be the next steps once you've been diagnosed. Some people meet with medical social workers to talk about how Parkinson's may affect your everyday life as you move through the journey. Starting a regular exercise program is very important once you receive your diagnosis, and we'll talk more about that in a little bit. Talking with family and friends who can provide you with the support you need is also an important role once you've been diagnosed. Some of the members of the Parkinson's team are you and your care partner. It's very important to know that you are your own best advocate. A neurologist or a certified movement disorder specialist, the physical, occupational, and speech therapist that we've mentioned, the social worker. Some people will see a nutritionist, a personal trainer. Some other members of a Parkinson's team may also include mental health providers, such as a psychologist, a psychiatrist, or counselors, an optometrist, ophthalmologist, dermatologist, or even a urologist. Again, varies from person to person based on what your needs are. So fighting Parkinson's disease, these are the things that we want to talk a little bit more detail about: managing medications, exercise, nutrition, education, social support, and the positive attitude. We're going to go deeper into each of these here. So medication is used to help manage the symptoms as well as prolong the current level of function. The purpose of medication is to restore the brain's concentrations of dopamine to near normal levels. Carbidopa levodopa is the most common medication. The dose of each of these medications is very unique for each person. The timing of the medication is very important. It will help your body have that constant level of the medications to prevent on and off times. And off time is when your levels of dopamine are lower. So it can happen as your medication is wearing off or while you're waiting for a new dose to kick in. Taking water with your medication helps with the absorption. The medication, carbidopa, levodopa, is absorbed through the intestine. So, excuse me, it has a ways to travel, and the water will help get it to the area in which it is absorbed. There are a lot of options for this medication. There is the regular carbidopa, levodopa. There's extended release. There are inhalers, a patch, a duopo pump. And there's also an option, a surgical option called deep brain stimulation. Exercise is as important as medication. It is very crucial to help maintain mobility, strength, and flexibility. It helps improve the ability to continue your ADLs, your daily living skills. There are some exercises such as pedaling for Parkinson's and rock steady boxing that were designed specifically for Parkinson's, but there are a lot of other options out there. Yoga, dance, walking, Tai Chi, aqua aerobics, and even voice aerobics to help with maintaining your voice level. The ideal exercise program is dependent on the individual disease and the severity. They do recommend a minimum of 2.5 times per week to be impactful in helping to slow the progression of the disease. Your exercise program should include stretching, aerobic activity, and resistance or strength training. And of course, you need to clear any new activity with the doctor and be sure to put your safety first. As far as nutrition goes, there's not an actual diet for Parkinson's. They do tend to recommend the Mediterranean diet and to drink adequate water. Some doctors will ask that you drink half of your body weight in ounces of water per day. It sounds like a lot, but it can definitely help with constipation, dehydration, and as I mentioned previously, helping to get the medication absorbed into your system. So the Mediterranean diet offers fiber-rich foods, lean proteins, limited sugar and caffeine. So again, all of this can help maintain your current levels of movement, and the diet and Parkinson's medication can impact each other as well. So levodopa medications such as Sinemet, carbidopa, levodopa extended release capsules like Ritari and Stalevo work best on an empty stomach. However, for some people, taking the medication on an empty stomach can cause some nausea as a side effect. So it might not be the best option. In that case, it may be helpful to take it with some saltine crackers. For others, taking Parkinson's medications close to a protein-rich meal may interfere with the absorption of the drug into the blood, causing it to work slower or less effectively. So doctors will recommend taking the medication about 30 minutes before a protein meal or waiting until an hour after your protein meal. As far as education, we know we get power out of knowledge. So by attending educational forums, wellness clubs, online webinars, symposiums, and our Expo to learn about the most current research, therapies, and treatment options can be incredibly empowering. The more you know, the more you'll be able to have an input and be your own advocate in your Parkinson's journey. I also want to put a shout out here to clinical research. If you go to clinicaltrials.gov, you will find a list of all research being done. We encourage you to think about being in a clinical study. Without the research, we're not able to progress further with our knowledge of Parkinson's and finding appropriate treatments. An optimal way to fight Parkinson's disease is through social support. Support groups help guard against isolation, fear, and depression. Meeting with others in similar situations is very empowering. Continuing to stay engaged with family and friends can be very empowering and can help you moving forward to guard against the depression. Continue to pursue activities and events with others that are enjoyable. Do what you enjoy. Have a positive attitude. Be a Parkinson's fighter, not a sufferer. Focus on the present moment and focus on all the positives. Attitude is everything, so pick a good one. Who we are. So Neuro Challenge Foundation, we are a local 501c3 nonprofit service, and we serve Sarasota, Manatee, Pinellas, Charlotte, and Highlands, and Marion counties. Since the pandemic, we've extended our service into the virtual world, so we're able to offer our services without limitations. Our mission is to improve the quality of life of people with Parkinson's and their caregivers today. We're currently serving more than 2,700 people affected by Parkinson's each year, and all of our services are free of charge. We strive to achieve our mission by providing people with Parkinson's and their caregivers a better approach to Parkinson's. In that better approach to Parkinson's, we offer these services. We have care advisors, such as myself, and we are here to help people with Parkinson's and their caregivers navigate the journey of Parkinson's by education, helping to provide support and community resource referrals. If you are interested in meeting with a care advisor, just give us a call. My number is on the screen, 941-926-6413. We'll be happy to meet with you. We can meet via the phone, we can do a Zoom meeting, or we can meet in person if possible. And we'll be happy to talk with you about where you're at with your journey, things to expect along the way, and what resources are out there to help you meet your goals and slow the progression. We also provide monthly educational support and therapeutic programs. We're facilitating over 45 monthly programs. We offer some of those programs in person and some of them are virtual as well. We encourage you to take a look at our program calendar on our website for the most up-to-date information about both the in-person and virtual programs that are being offered. We offer a Distinguished Speaker Series semi-annually, and these are a mid-size education program with local speakers presenting on various topics that are related to Parkinson's. We host the annual Parkinson's Symposium in partnership with Sarasota Memorial Healthcare System. And we have our annual Expo. It's our signature event, day-long event to create, educate, engage, and empower the Parkinson's community. Again, we have the three tiers here: the support programs, the therapeutic exercise programs, and the education programs. All people affected by Parkinson's disease live a life wellness with hope for the future. And our core values, our team is committed to excellence, compassion, empowerment, innovation, and partnership. Our strategic goals include to increase access while maintaining exceptional quality and impactful programs and services, to educate healthcare professionals and support effective diagnosis and treatment of Parkinson's, to improve long-term financial health and sustainability, to embrace and cultivate a culture of philanthropy, and to strengthen organizational infrastructure and operations. For more information, you can visit our website at www.neurochallenge.org. Again, our program calendar is listed there for all of our upcoming events. And a reminder that all of our services are free of charge. You can sign up for our newsletter or email us at info@neurochallenge.org or contact our office again for the care advising session. We do not need a doctor's referral. You can just reach out to us again at 941-926-6413. I wanted to touch on the red tulip here. In 1980, a Dutch horticulturalist developed a red and white tulip, naming it for Dr. James Parkinson. The red tulip then became the international symbol for the World Parkinson's Disease, celebrated annually on April 11th. In 2010, two people with Parkinson's further developed the symbol, adding a P and D in the shape of the green leaves. One smile, one friendship, one disease, one flower. Again, we appreciate you being with us today. Together we are strong. Please let us know if we can help you moving forward in any way, and enjoy the rest of the expo.